Women have been charged a lot more for insurance historically because we use more. Okay, here's some other, so here's the other important things, and I kind of talked about some of these before, but I want to make sure you're very clear of it. And I also down here, I don't know how well you all can see it because it's kind of small, but I give you the little guidelines about what these percentage of poverty level things are, so you can check to see where your income level is and kind of where you would be. So you remember, they're gonna expand Medicaid to 133% federal poverty level. So anybody that's non-elderly, non-disabled, even a childless adult can then be eligible for Medicaid if you're making less than $14,484 as an individual or $29,726 with a family of 4. So that'll just give you an estimate about what that looks like. And then also, if you go to an ITU, you're not going to be charged a premium, a copay, or any other form of cost sharing, so they can't ask any funds from you. So here's some challenges. So we're almost at the end here. I want to talk to you about the challenges. This is a real big one, and this is one that you guys can actually affect. Like, you guys can actually make a contribution to support this. One of the things that we got passed in the law, and I know why tribal leaders wanted to do it, because they did not want Indian people to ever have to suffer for anything about this. And how many of y'all heard about that individual mandate? Because in this act, this is the most controversial thing of this act, is that this act now forces everybody in the United States to have insurance except Indians. American Indians are exempt. Now, you can get it, you're eligible for it, you can get it, but we exempt it. You know why? The tribal leaders were really intentional about this. They wanted to make sure that you weren't going to get a tax penalty if you decided not to enroll. Because under the Affordable Care Law, for any American in the United States that's a non-Indian, if they choose not to enroll, they could be hit by the IRS with a tax penalty, okay? But Indians are exempt from that because the tribal leaders didn't want you all to have any kind of penalty by the IRS. So what this means, I mean, it's good in that you don't have to worry about any kind of exempt from the tax penalty, but the problem is that if there's no penalty, then there's no reason to enroll unless you just recognize the importance of having insurance. And so really what we're going to have to do is really educate our community about how having insurance supports our entire community. It supports your relatives, because you're bringing money, you're bringing resources into your community for health care. So when you come with an insurance to the clinic, you're actually bringing in additional resources to support all your relatives, to support your entire community. So that's the education that we need to be doing within our own communities about the importances. If you're eligible, gotta enroll, because you're bringing money to your community for health. So the definition of Indian is going to be a challenge. So right now, Medicaid in the federal level has defined Indian in the broadest way possible. So they define Indian as either a federally recognized tribe, Alaska Native villages, of course, are in there, and then if you're served in an urban center, which this is an urban center, and you're state recognized, you're federally recognized, or you're recognized by the local community as being a part of the community and you self-identify as American Indian, then the Center for Medicaid and Medicare Services considers you an Indian. Now, that's really important for urbans. Does anybody know why that's really important for urbans? For urban communities? Bring in more funds. More money, yeah, that's good. But it's also that during that relocation program, it really messed up a lot of people. And I'm sure many of you all know in here that there are people that are living in urban communities and they're Indian, but they don't have their card. And you know they are, because you've grown up with them or whatever, you know they are. But a lot of them can't get back home to get their card, and there's a lot of transportation barriers or whatever. And the other thing is that a lot of the state-recognized tribes ended up in urban settings because they lost their land when the feds, particularly if they were federally recognized and then it was pulled, or if they had lands then a lot of them were relocated and dislocated. So the state-recognized tribes are an important one to include as well. So we've been dealing with this as, all the tribal leaders have really been talking about this and trying to figure out what this means. And, it's a struggle because sometimes people say, oh, well, the more people that are Indian, the less resources. Well, it's opposite in this particular law. And the reason it's opposite is because the more people that are counted as Indian, the more opportunity, because they have more opportunities to have a payer source, whether it be Medicaid, state exchange, or whatever, and it's more money that you can bring into your community. So in this particular law, the more people the broadest definition of Indian is much more helpful than is a real narrow definition. Now, the entity that we're waiting on to make this definition is the Internal Revenue Service, the IRS. We've got to work with the IRS and really encourage them, and the tribes will be consulting with them about having a definition that is inclusive to Indian people. You know, we really, at this point, so much money has been spent in implementing the health reform law that it would cost the American people way too much money to repeal it. So we kind of think that the only thing that's really going to be the challenge is that individual mandate that everybody's all upset about. Even though the mandate would be a benefit for the entire society because everybody's going to have some insurance and it's going to reduce all the costs of health care. But that individual mandate is causing a lot of problems for people. So right now the mandate's been challenged. 2 judges found it constitutional, that it's okay, like it's within the constitution of the law. Within the constitution of the law, they found that it was constitutional. 1 judge said, nope, it's not constitutional, you can't do that. So now we're at a place where it's probably going to go to the U.S. Supreme Court. We suspect it might go to the court by the end of this year, and they're going to be making a Supreme Court decision about whether or not the United States can mandate that people have some form of health insurance. So here's some implementation updates. I told you about that donut hole rebate checks. In Michigan, there were 90,795 Medicare beneficiaries who got a $250 rebate for those that were in the donut hole last year. So there were over 90,000 people just in Michigan alone. There's a pre-existing condition insurance plan, and 89 people, and this pre-existing condition insurance plan was for people who got kicked off their insurance because they were too sick. And so there's this pre-existing condition insurance plan that is kind of a supplement to try to help get people through until 2014, because a lot of these things don't come into effect until 2014. And then the state of Michigan got $1 million to start their health insurance exchange. And so they're currently in the process of doing that. And again, they have to talk to this clinic as well as the tribes before they make decisions about that plan, which is a good thing. So this clinic and the area tribes, the 12 tribes in Michigan, are really going to have to make sure that they're there at the table and making sure they're thinking about all the issues and making sure they're getting your needs met within that state exchange program, so the Indian people are going to have access to that thing and it's going to work for you. So stakeholder involvement, you got to have your tribes and your urban Indian clinic there at the table. And then there's all kinds of money that was doled out for special projects, and in the state of Michigan, they actually have 89 different projects right now to look at innovative strategies for supporting healthcare. So the state of Michigan got $18.4 million for that. And then the state of Michigan also got $14.85 million in grants from the Prevention and Public Health Fund. So that gives you kind of a little breakdown of some of the projects they're doing for expanding their workforce here in Michigan and trying to meet some of the health challenges that they have and trying to keep up with the 21st century of healthcare with all these electronic health records and things that we're going to. And then they got some funding for some clinical prevention activities as well here in Michigan. So what can you do? Here's what you can do. Educate your community, educate your family, educate yourselves on what is in the law for increasing health coverage to Indian people. You can also remember the importance of having insurance protection. It's not only important to you because the IHS system is underfunded at 50% of care, so that means you can't get specialty care. And has anybody ever tried to use contract health services? Who? Contract health no, from your tribe? Well, it's federal money, yeah, but you have to go through the tribe to get it. Contract health services is a way for the tribes to be able to provide specialty care if somebody needs a surgery or they need a specialist. And you can sit on, they always say, don't get sick after June. because they run out of money in June, and then you better not get sick because there's no more contract health dollars. And we also, and, you know, we laugh about it as Indian people, but, you know, and I laugh, we all laugh, it's really not funny, you know, that they're funding this that badly, that poorly. But you know, we do laugh about it because that's how we cope. But they say don't get sick after June. We also say life or limb. And if you're going to contract health services, you have to be life or limb, or you're not going to be able to get any coverage through that. So that's another reason why it's really important, if you're eligible for an insurance, that you sign up, because that's really important. And then finally, having insurance not only protects you, but it supports your relatives, so remember that. The other thing is get involved. You have the right to contact your House of Representatives and tell them what you think. You have the right to contact your senators in the state of Michigan and tell them what you think. You vote. You have the right to vote. They're your representatives. They're there to hear your voice, and so you have the right to call them. So don't be shy. Reach out to those House of Representatives, those senators, and tell them what you think. Get on the national listservs, and I have some of those for you, and then connect with your state. Make sure you're getting involved, understanding what's going on, and seeing what you can do to help. And here's some resources as well. Healthcare.gov is a great resource. Go check it out. It's got all kinds of information. You can kind of Google anything and it'll tell you what, or put in the search engine for anything and it'll kind of pull things up for you. And then also the National Indian Health Board, the National Congress of American Indians, and my organization, the National Council of Urban Indian Health. We're the three organizations doing education and outreach on healthcare reform to Indian country.